Hi, my name's Stephanie Shea, and throughout the summer I've been interning at Turo Infirmary. Here is my scrubs. So this is my volunteer badge, and one of the first challenges I faced was figuring out where to clip the volunteer badge. I was putting it on the pocket, but I'm too short to reach all the door scanners when it is on the pocket, so that was an issue. But luckily someone on the staff told me how to clip it so it's more effective. So that was one of the challenges. Some of the other challenges that I faced, especially during the first 2 weeks of my internship, were figuring out where I belong and how to interact with patients. The first day I showed up, it was extremely busy in the emergency department. Patients in every bed, tons in the waiting room, and a lot of psychiatric patients, which requires that the staff is constantly watching. One staff member is constantly watching the psych patient. It's called strict visual contact. So that's at all times that they're in the hospital, which means that I think we had 5 psych patients, so 5 staff members were doing that instead of doing their normal working things. So I showed up to a busy scene. It was a little bit overwhelming. I didn't really know how I fit into the equation. But I learned. And also, I was really afraid to interact with patients in the beginning. I wasn't sure what I could do for them. A lot of times they ask you questions, and you have to say, oh, I'm sorry, I'm not your doctor, I'm not a nurse, I'm just a volunteer, but I'll get someone in here who can answer your question. And I felt bad not knowing the answers, so that was kind of something I had to get used to. But I quickly learned, go into patient rooms, give them blankets, ask if they need anything. If they ask for water, always check to make sure that they can drink water because they might be heading to surgery or getting admitted or whatever. They might not be able to eat or drink. So little things like that were big challenges the first couple days and couple weeks that I was at my internship, but quickly became second nature. And just to give you an idea of that, the first day I was in the emergency department, I didn't go into a single patient's room except once with a nurse to watch blood being drawn, I think. And today I went into every single room and asked what patients needed and did it for them, and that was pretty incredible. I've seen a lot of connections through the readings and the videos that we've had to watch for class. I've seen connections to my internship, and I've really enjoyed the articles and the videos because they've made me think about my internship in a different light. It's easy to go somewhere, volunteer for a few hours, go home, not think about it till the next time you're there. And I think this class really did a good job of making me think about it and comparing it to other people's internships and realizing how different everyone's internship was and how important it is that we all have this unique experience. So some of the things that really stood out to me were the articles on civic engagement. I now feel like I've had exposure to the diverse community of New Orleans that I really have not seen before through Tulane, and it's given me more of a motivation to stay here and do healthcare here, but also just be involved in the community and know your neighbors. There's a lot of patients that come through the ER more than one. Like I've seen repeat patients, and just driving home today from my internship, I saw one of our patients that we had 2 weeks ago, and I recognized him because he was in there for a while, and that was pretty incredible. Saw him just taking his groceries across the street, and it was cool because it really impacted me. I saw him in this hospital setting, and then all of a sudden he's out on the street, and he's a real live New Orleanian person, member of the community, and I helped him in some way, or Toro helped him in some way, and you have the ability to get people on their feet, which is cool. Also, the article that talked about the role of hospitals versus nonprofits and businesses really hit home for me because it made me question, what am I doing at the hospital and what is the hospital doing for the community and how does that all function? And I think I've started to come to terms with the fact that the emergency department is quick treatment. It's not like you're pointing at problem and figuring out how to fix it so that person can go home, back to their life, wherever they're from, and move on. And so that's very important and necessary. We are in the business of relief work. but it's also frustrating at times, and one of the other challenges I've faced is not being able to help everyone in the way that you want to. We might patch up someone's leg, but not got at why it's broken in the first place, and they might come back the next day with a broken arm because they're sleeping in an unsafe situation, or who knows. We don't really prod, is what I've learned. And so that to me is really frustrating because it's very clear to me that we could always be doing something more. And I think that as I realized the role of a hospital, I always also realized through those articles the role of a nonprofit in being able to step in and partner with a hospital and help someone who comes in homeless get services so that they don't have to be homeless anymore. Or, they could train us volunteers to be doing something more specialized that they could use in the emergency department. So those were both really interesting things. And also, I think something that the class work really pointed me towards is how Tulane fits into the whole big picture of the community and service, and how does our service learning really impact the community. And it's something that I'm still trying to figure out. I don't have any solid answer on that, but I will say that I think service learning is what you make of it, and I think that we as students have this ability to bring our knowledge to our internships and to our service learning, and anyone can volunteer, but we've gotten a specific education at Tulane, and if we can take what we've learned in our classes and from our classmates and the environment that we're in and somehow bring it to the community, and at the same time take what the community has to offer that we haven't learned about yet, and because a lot of us aren't, I know I'm not from here, and sort of bring it all together, then it can be something amazing. And that's still something that I'm trying to do every time that I show up to my internship. Some feedback that I have from my supervisor would be that to make the emergency room walkthrough, so we had 2 orientations and the ER walkthrough was the second, I would make that more comprehensive, show us where things are. Like, one of the first days I got asked to grab a wheelchair, I didn't even know how to get from the emergency room into the department area into the waiting room outside, because you have to go through a door and you have to use your badge, which I had clipped on the wrong pocket. It was just overwhelming, and I didn't know where the wheelchairs were, and someone was passing out and needed a wheelchair immediately. And little things like that. Also, explaining the hierarchy of scrubs would be really helpful. Everyone is wearing a different color scrub pretty much, starting with the ER technicians wear one color scrubs, the nurse technicians wear another, the nurses wear another, the doctors wear another, and that's often always changing. And then some people aren't in scrubs. What are they doing? So just the hierarchy would have been really helpful, and just like a direct person to go and talk to with issues or questions would have been really helpful. But also, I think something that I've really learned to appreciate through our coursework was having an orientation where I learned about the history of Toro, because at the time I didn't think much of it and was kind of bored by it, but knowing its history and where it's been is, I think, so important to understand where it's going and its role and impact that it's had on the community. And so I really appreciated that, and I think they should absolutely keep all of the history in the orientation, and the old commercials of Toro are very funny. So good entertainment. Advice for future interns I have: don't be afraid of the staff. They're really friendly. They seem intimidating because they all know each other, but once they get to know you, they'll joke with you, they'll tell you about their lives, they'll ask about yours, and they're way more willing to show you medical things and invite you along. So that was really important. Also, interacting with patients is the most rewarding part of the job, and it's the reason why I want to go into medicine, so that's for sure something that I would encourage future interns to do. And figure out what your contribution is. We all have one, you just have to figure out what it is. So for me, I would say the biggest things I brought to my internship are a positive attitude and compassion, as well as empathy. In my classes at Tulane, specifically through my PsyC studies, I've really learned the importance of empathy. And I always try and bring that to my internship the second I walk through the doors, to minutes past when I leave. Also, in the same way, past experience, I've been a patient in the ER upwards of 10 times, like between 10 and 15, and I think that's really helped me understand how scary it is and how important it is to have someone to advocate for you if you're a patient, and a lot of these patients show up alone, so I'm happy to be that person. And something very more specific that I have helped outside of the emergency department, I'm helping with a career camp, which takes place next week, so it hasn't actually occurred yet. But I've been preparing team-based learning exercises, which is something I learned through one of my Tulane classes through biochemistry. And I'm also making empathy worksheets and just in general making activities for the camp. And all of these activities are coming from my past experience at Tulane in the SICE program, and specifically the design thinking class. So that's been really exciting for me to finally get a chance to use these skills, and I'm looking forward to the career camp next week. I wish I could let you know how it goes, but I think for that in general, I just bring a new perspective since I haven't been a part of it before, and I have a very different skill set than most of the people working on it were like pre-medical people, or which I am, but science majors focused on the science, and I think there's a lot more to medicine than the science. So overall, there's been lots of challenges and successes, but I've really loved this internship, and I'm hoping to continue it into the fall semester, not for credit, just for fun. And I hope everyone else enjoyed their internships too. This class has been really awesome, and have a great rest of the summer.